how did you get started using clinic? What made you want to start your own practice?
I wanted to start my own practice because I had been working with other people, working in other offices where I didn't have a whole lot of control over the patient's additional care. And there were areas in which I would have done things differently, and those were really out of my control, even though I could, give a recommendation to the physical therapist or whoever else was involved with the care. It didn't necessarily mean that was what was going to happen. And I really wanted to have a way that I could go and treat a patient with a chiropractic adjustment and then also give them the other therapies that I think that they really need and really communicate with them what I need them to do outside of the office.
And so before you started your own practice, you worked for big corporations, or who did you work for?
Basically, before I started my own practice, I would work for, it would usually be I was working for a chiropractor who had a business that was part of a larger business that was the multidisciplinary practice. So it was usually working for one other person.
What was the biggest obstacle you faced starting your own chiropractic practice?
The biggest obstacle I faced starting my own chiropractic practice was mostly funding. It was trying to find the small business loans and leasing, the kind of stuff that was going to help me get equipment and the space that I needed in order to jump that hurdle. Another obstacle was, not a huge obstacle, but it was a process, was to become an in-network provider for lots of different insurance companies. And so what that means is if somebody is looking for a doctor, whether it's a chiropractor or a ENT or whoever, they're going to use their insurance website or their insurance provider enrollment line to find an in-network provider that is going to be so that they just have to pay a copay or they only have to pay their coinsurance, so that they're not paying out of pocket and hoping that their insurance company reimburses them. So that was another big obstacle, was to become an in-network. That was another big obstacle, to become an in-network provider with different insurance companies, because it takes a lot of phone calls, a lot of follow-up, and then once you get yourself in and the application is in, it's basically going to happen, but it also requires a wait time. It's usually 90 days. So once you get in, you're gonna be waiting 90 days until it happens, and you're still not exactly sure if it's gonna happen.
What are the requirements then? How do they say this person is not good enough to be on our network, this person is?
When it comes to the insurance company, depending on the company, they have different requirements for their in-network providers. Mostly they want to know that your license is in good standing, that you've never had any malpractice claims, and then the other part of it is that they don't want to flood their network with providers in one area, because at that point then it becomes cost ineffective for them to have multiple providers within a certain radius. So for some of them, for one of them, I actually had to call and say, give them information about, here are the train stops, here's what it would be like for somebody with a disability to get from this stop to that stop, from this neighborhood to that neighborhood, and explain, in their scope of geo-accessibility is what they call it, that you'd have one provider that may be inside that bubble, but is still really difficult to get to. And so to explain that to the insurance company and say, hey, I'm a provider that I can provide within this zip code. People can get to me easily, accessible building, elevator, subway stops, to show them that it is worth having me as a provider.
Okay. Well, my next question was going to be, what was the biggest thing that's drawn you to this profession? Really kind of answered that already, but if you have anything else to add to that.
The biggest thing that drew me to this profession is that it works. It worked for me, and I see it work every day. I see people get better. I see them get better from things that they didn't know they could get better from. It's extraordinary to me that, we don't get a whole lot of education about our bodies. It's, we have a health class and we learn about sexual education, but there are so many ways that our body works and that it won't work when we don't treat it properly. So there are so many ways in which people don't know that they can get help or that they can help themselves. And so when I show people the ways that they can help themselves, and when I provide them relief for something that they either didn't know or nobody ever was able to give them the proper access or treatment, it's extraordinary for them. It may have been something that you just plodded along with, and it was at some points it was no big deal, at other points the issue was bigger, but in the end, you start to feel better and you understand what it's like to not have pain or not have limitations. And that's really extraordinary. So I see that all the time. And that is really, really fantastic for me. And I love that.
My next question kind of falls into that. You're the biggest thing that draws you to it, but what's your favorite thing about being a chiropractor?
My favorite thing about being a chiropractor is seeing people get well. Seeing a positive change in my patients that they may not have known about the possibility of.
So what does an appointment with you consist of?
So for an examination, you're going to come in and I'm going to check out your body. I'm going to move... Oh, back that up. So an examination would include me looking at all the different aspects about the way that your body functions. So what I want to know is if you can handle certain movements, if your body can resist certain movements, what your strength is like in all your extremities, what your strength is like in your core. Also, where you're having pain, I'm going to find out that. I'm going to find out where the tender spots are. I'm going to take a look at the muscles. I'm going to take a look at the position of your vertebra. So we're going to put all these things together to get a good clinical picture of what's going on with the patient. And then the other side of that is the treatment. So treatments are different for everybody. Now, what I always want for my patient is to give them a chiropractic adjustment because I think it's profound. I think that it does a lot for a patient. The other part of it is that there are lots of times, almost every time, there's some sort of muscle issue. And the muscle issues don't always calm down with chiropractic adjustment. So the patient needs to have some sort of muscle therapy. We do that through all different sorts of ways. I use ultrasound, electrical stimulation. I use a technique called myofascial release, where I'm putting a lot of pressure into the muscle while I'm lengthening the muscle. It's sort of like a really aggressive deep tissue massage. I do other things that are, I use therapeutic taping. So I will essentially apply tape to a certain part of the body. This tape being on for about 3 days will help that part of your body heal better. I also do rehab. That's really important. So we do these things with the muscles to make sure that they are relaxed and sort of reset and that they do their job properly. Well, now we have to teach them how to do their job properly. So the other part is going to include exercises, stretches, and all these things I don't prescribe, well, you need to do 20 minutes of cardio and you need to, that's important, but that's not what I'm focusing on. I'm focusing on the specific muscle issue. A lot of times patients sit all day long. That's the biggest issue. And so I have to help them teach their body how to sit. So we do exercises that change your posture. And then those exercises are also designed to help prepare your body for doing that work all day long, to make your body, you build endurance for that activity. Just like if you're training for a sport, you need to train for an activity that our bodies weren't really meant to do. Because sitting feels nice, but then when you sit all day to work, then your body changes and it works harder in ways that it shouldn't.
Okay. What would you tell somebody who's scared of the idea of going to a chiropractor?
Something that I see people in my office that are still very afraid. So when we start the examination, I make it very clear that when my hands go on them from that point, we're only going to do your examination. We're not going to go into your treatment. Because, like you said, there are many people that are afraid of it. Because if you've seen a video of a chiropractic adjustment, especially the neck, and you've also seen a spine moving, you see people getting their neck broken somehow. It's like, and I can't even imitate it. Like, I have no idea how you would even do it. And that's what I tell people, is that there is a huge difference. You know, when I'm moving your neck, I'm not moving it past its ability. We're only moving your head just till we get this certain motion. You hear some clicks and pops, and it's just the joint opening up. So that's what I always explain to people, is how oftentimes people are worried that there's something breaking or actually tearing or something like that. And all it is the two surfaces of the joint are really close together. There are tons of these little joints in the back of the spine. And you move these joints, they open up, and as you open them up, this suction is created, and then it breaks really fast. And it sounds really loud, especially in the neck, because it not only can you hear it, it also conducts through the bone. So you get this loud popping noise. But in effect, what's happening is that you're just getting more movement in that area of your spine.
I like the fact that you can make that sound with your hand.